I am Dr. Shalini Chico. I am Senior Consultant Neonatologist at Fortis Hospital, Richmond Road. I am here to talk to you about the importance of breastfeeding and especially for preterm babies. In this month of August, when we've just celebrated Breastfeeding Week, we always try to encourage and educate mothers about the importance of feeding breast milk to their babies. Breast milk, as you know, has a lot of advantages, not just for the baby but even for the mother. So, mothers who breastfeed more are shown to have lesser risk of cancers like ovarian cancer, breast cancer, and also less incidence of heart disease and diabetes. And for the babies, of course, there is lesser incidence of infections like diarrhea and pneumonias, and long term benefits like protection from allergies, and even a higher IQ has been found in babies who breastfeed. So, WHO recommends that breastfeeding should be done in the first hour of life, that is called the first golden hour, and the earlier the baby is breastfed, the more successful the breastfeeding. So, even skin to skin contact is important soon after delivery. But what happens in a preterm baby? Sometimes babies who are born before 34 weeks may not be able to suckle immediately. They may require to be taken to the NICU for breathing issues, or they may need to be resuscitated. So, in that case, the immediate breastfeeding may not be able to happen. What can a mother do in this case? The mother might be quite stressed out that she is not able to breastfeed the baby. What you could do is that start pumping as early as possible. The colostrum, that is the initial milk, is loaded with antibodies, which is very good for the immunity of the baby. So, from day one, if the mother starts expressing colostrum, which is just the first few drops of milk, that is given to the baby into the baby's mouth by the nurses or the staff in the NICU, and as the mother continues to pump every 3 to 4 hours, day by day the milk production increases. So, that is the best way to get the breast milk up. Also, speak to your doctor in the NICU and ask if the baby is ready for kangaroo mother care, because kangaroo mother care, keeping the baby in skin to skin, improves the bonding of the mother and baby and improves the chances of successful breastfeeding. Even babies who are on oxygen or who are on IV fluids can also undergo kangaroo mother care. So, the milk day by day it is increased, and for preterm babies sometimes we give the feeding through a feeding tube or by a method called Palada feeds till the baby is able to breastfeed directly. So, coming to a mother who does not have much milk, what if the mother is maybe either sick or she is stressed or she is not able to get more milk? We have a option of giving donor human milk. So, rather than giving formula milk for the babies, because the preterm babies especially are not, they do not have the intestinal maturity. So, they may not be able to tolerate formula milk, and sometimes there is more risk of infection. So, second best to mother's milk is giving donor human milk. So, in our hospital we have Amara, which is a human milk bank which has been started 6 years ago, and we collect milk from donor mothers, that is mothers who are getting excess milk either from our NICU babies or our hospital or hospitals all over Bangalore. Mothers who get excess milk do donate to our milk bank, and that is pasteurized, and then that milk is given for the NICU babies. So, the donor milk cannot be used for all babies who are term or for surrogate babies. These are for only those who are NICU babies who are preterm and who are at more risk for getting infections. I will just take you through the donor milk bank and what we do there. I am now going to take you through what a milk bank looks like. So, this is one of the first milk banks started in Karnataka. This is actually the first non-profit milk bank which was started 6 years ago, called Amara Milk Bank. So, from here we take milk from donors and we store it in the fridge and pasteurize the milk, and it is sent to the NICU. So, we have a milk bank staff. This is Sister Tabitha, and Jai Kumar, he is our runner. He goes and collects the milk from the donors, and sometimes he helps to go and collect the samples and dispatches. So, we have a runner and a nurse who helps us. So, we have a fridge. This is a fridge which stores the milk at minus 20 degrees centigrade, the freezer. So, we have the donor milk here. So, this is the milk which has been donated, which is stored in bags like this. Okay. So, it is frozen at the donor's home and it is stored and brought back, and once the milk is stored in the bottles like this. This is the pasteurization. This pasteurization is done here in this room. So the process of pasteurization is done just to make sure that the baby doesn't catch any infections, and the mothers who donate the milk are screened for infectious diseases like HIV, HPSAG, VDRL, to make sure that all the babies who get the milk are safe and they don't catch any infections. Urge all breastfeeding mothers to please ensure that your baby gets breast milk, exclusive breast milk, for the first 6 months of life. And now that the more and more guidelines about breastfeeding, even while you go back to work, do ensure you continue breastfeeding even after 6 months of age, rather than giving formula milk. You can always pump the milk, and if at all any mothers are there who do not have milk while their babies are in the NICU, be aware that there are donor milk banks, and you can rather give donor milk rather than giving formula milk for your babies.